From basketball to volleyball and even non-contact sports like track and field, ACL injuries are common in the sports world. So how do we approach it as PTAs? What do we need to know? And we'll even touch on something that isn't in your textbooks. Let's study ACLs. We're going to be taking this in two different ways. One, the clinic point of view, and two, your book point of view. The first thing that you need to be knowing is protocols. The reason why in the book it's not specific on what protocols you should be using is because every surgeon is different and depending on what kind of graft that they did. The first thing that you should be doing if there is no protocol list attached is asking your supervising PT the approach that they would like to take. Depending on the time that it's been for the surgery, the patient is most likely going to be in a knee immobilizer, so knowing how to don it and doff it, having some practice before they show up can shave off some time and get you more familiar about what you're about to do. Each patient has a different weight-bearing status. Protection of the surgery is important, so something like knee extension from 40 degrees to 0 degrees should be avoided just to protect that graft. Another thing that should be avoided is ambulating without the immobilizer being locked. This will just prevent from their knee buckling and causing some more pain. If at any point you're unsure on how to proceed, always check your protocol list or ask your supervising PT because you do not want to be upsetting the surgeon. Let's talk interventions. There's quite a bit of interventions that we're going to be doing, so let's just start from the top. Initially, you want to be protecting the integrity of the graft, controlling the edema, improving range of motion, kind of the feel-good kind of things, except the range of motion because a lot of patients find that uncomfortable. But very important. Incision, scar tissue management, it is something that's also can increase with sensitivity with the patient. So working on that mobilization is good to kind of prevent that scar tissue underneath and still improve their range of motion. Specifically doing activities that help control the pain, improve the patellar mobility, active range of motion exercises, gait activities, and quad exercises because you want to build up that quad strength are things that you're going to want to do throughout their treatment. Later in their program, the shift of focus can switch more to strengthening activities with emphasis on closed chain exercises. The easiest way to kind of explain a closed chain exercise is that the foot is fixed and your body is the one moving. There is a more technical definition, but that's what we're going to be going with. So some examples of closed chain exercises are squats and lunges, both good for leg strengthening. The reason why we do closed chain exercises is that they minimize anterior translation of the tibia and are more functional for the patients. Shifting on over to home care should be including everything you're doing at the clinic. So things like range of motion, strengthening, anything that's functional for their appropriate stage, and a lot of patient education because you still want to be protecting that graft. All right, so what about the outcomes? The outcomes are different between non-op and operative. Non-op, you have the possibility of return to light and moderate athletic activities without surgery. From an aggressive strengthening program is kind of depending on the patient. So this one can vary in time and kind of depending on what they want to go back into. When you have surgery, their functional level can be returned in 4 to 6 months, and this depends on the athlete, depending on what sport they're playing. But textbook wise, you have 4 to 6 months of return. So let's change from textbook to outside the book. Things that you need to keep an eye out for in the field because you may run into them, even though they're not in the textbook, it's what's becoming more and more, I would say, accepted. One is starting open chain exercises earlier than anticipated. Again, this is something that I would just lean more towards the protocol list and your supervising PT, but you may see people starting open chain exercises earlier than what's typically in the textbook. Another thing being performed for ACL tears are BFR, or blood flow restriction. The reason why BFR is being used is that it helps get the strength benefits, but without putting the graft under too much pressure because you don't need to do as many repetitions of a certain exercise. These are just a few things that I wanted to mention that are not technically in your textbook, but you may run out when you start practicing. Well, that just wraps up our Let's Study ACL video. Do you have any favorite ACL post-op exercises? When do you start open chain exercises? And any tips for studying for board exams or just other tests? List them in the comments below. I'd love to read them. We also have a podcast talking about this topic in greater depths and our experiences out in the field, so check out the description for the links to that. Thank you so much for listening, and we'll catch you in the next one.